So for the pathologic sign on the frontal view, you need to know that what in the frontal view, when you have the frontal view, there's a mnemonic so to easily show the pathologic sign of the frontal view. You have the A, B, C, D, E mnemonics. Is it clear? So we're going to have A is going to correspond for the airway pathologies. B, airway disorder pathologic sign. B is going to show you the breathing pathologic sign. C is going to show you the cardiac silhouette. Is it clear? And the cardio thoracic ratio. Is it clear? The D is going to show you the diaphragm disorders, and then E is going to show you particularly with pulmonary effusion, pleural effusion signs. Is it clear? Pleural signs. So I'm just going to explain each of them. So I'm going to start with the first one, which is the airway sign. Airway sign, and what does it correspond to? Now you can have an x-ray. So let's say that this is your x-ray here. You can have in x-ray, you need to visualize the airways. Is it clear? And the airways, when you visualize the airways, you start from the trachea, is it clear, above, and then you descend. Is it clear? You descend to visualize the two bronchi. Is it clear? So this one I've drawn it particularly in this way because the right bronchi is shorter and straighter as compared to the left bronchi. That's why when there is aspiration, it's going to cause consolidation syndrome, or opacities located at the level of this location in the right lower lung field. Is it clear? You're going to visualize consolidations, particular consolidation syndrome, but you're going to visualize opacities here. Is it clear? Heterogeneous opacities here. So this is straighter. Now you're going to have the different bronchioles that comes out. Basically, you have bronchioles that come out, and it's all inside. To distinguish them, you are going to see dark pattern, dark lines. When you see dark lines like that, you know that they are bronchioles. Here also, you're going to see dark lines. You know that they are bronchioles or secondary bronchi. These are the primary bronchi. These are the secondary bronchi. Now, after the secondary bronchi, they're now going to have the bronchioles, which are very thin line. So you're going to have the bronchioles. So you have very thin lines there. Are you getting? You have the bronchioles. Now, those thin dark lines, you need to visualize it very well on the X-ray to know the pattern of the airways. Is it clear? Now, the disorders that you can have deviation of the trachea. You can have deviation of the trachea, and usually deviation of the trachea is actually the deviation of the mediastinum. Sometimes you may have deviation of the trachea without having deviation of the mediastinum, but most of the time we have deviation of the trachea and we have deviation of the mediastinum. Is it clear? Now, if the trachea deviates, when the trachea deviates, what are the things that you can think of? The trachea can deviate either toward a lesion or it can deviate away from a lesion. It means that if you see the trachea deviating here, you look the two lung fields, you visualize that there is a problem on this part here. It means that it's deviating toward the part that is having a problem. Now, if the trachea deviates here, you look here, there is a problem instead here. It means that the trachea has deviated away from the affected side. Now, the etiologies of trachea deviating toward and away. When a trachea is deviating toward the pathology, it means that there can be atelectasis. Atelectasis means a lung collapse. Is it clear? And we have also etiologies of lung collapse, particularly in the case of a pulmonary tuberculosis. Is it clear? You have lung collapse in pulmonary tuberculosis in children. It can be congenital or acquired. Congenital, you are going to have things like congenital, you have things like acute respiratory distress syndrome, where you lack surfactants. Is it clear? In children, it can result to lung collapse. That's a congenital abnormality. You can have also bronchodysplastic syndrome, which can be taken still from birth with atelectasis, no problem. Those are the elements. Now, for the acquired, we are going to have infectious etiologies like pulmonary tuberculosis. We are going to have mostly traumatic etiologies like pneumothorax. Pneumothorax can cause atelectasis. So everything which can cause atelectasis metastasis is capable of deviate the trachea toward the affected site. So we have atelectasis, which associated with that. Another element associated with deviating toward the affected site, we are going to have malignancies. Is it clear? So a malignancy can deviate also the trachea toward the affected site. So when you have malignancies, particularly lung or secondary malignancies of the lung, when I say secondary malignancy of the lung, it means that there is a metastasis. When I say primary malignancy of the lung, it means that there is a primary cells which has grown there, and they can be divided into small cell carcinoma, we have large cell carcinoma, and we have other cell carcinomas. Those are the different things you have to know. So when you have those malignancies, it can also deviate the trachea toward the affected site, particularly when you are seeing that in old age patients who have been exposed to smoking. Now, and you need to know that smoking, lung cancer is the most common carcinoma